Investors always want to know where we are, right? It is a time to get in, and I think we saw the kind of the flooding of cash in the markets during COVID, and that was followed by the nuclear winter,
the opposite,
which we referred to, and that was about a 3-year period. And it seems like in the second half of 2025, things started turning around. If you look at the XBI, which is a good index, that went from the 60s to 130. And then also we saw M&A pick up pretty substantially in the second half of 2025 as well. So with that as background, where do you think we're going in 2026 in terms of the markets? What is your sense of investors?
Yeah, coming out of JP Morgan a couple weeks ago, maybe it was a couple weeks, I rarely remember what day it is, but coming out of JP Morgan, the overall energy and perspective and just feeling of good things happening was something I haven't seen. I've been going to JPM for 10 years, and this was Cingulate's best year by far in terms of talking to potential partners outside the U.S., capital raise, meeting with dozens of different banks saying, hey, we'd love to work with you guys. We can help you raise the capital in a very fundamental investor perspective way. So working with investors that have sticky money, they want to come in, they see what the value is. So it's definitely a much more optimistic time than we've seen in the last 4 to 5 years for sure. On top of that, we're in the CNS space. So CNS got beat up pretty good over the last 10 years. There's been a lot more interest, a lot more capital, lots of M&A as well flowing into the CNS-related companies. That definitely bodes well for us. Oncology has taken a little bit of a hit, not much. It's still an exciting and fascinating area where money does go into. But we're looking at a shorter time frame too. That countdown clock doesn't go to years. It's days, hours, minutes, and seconds.
May 31st.
So having a short time frame as well to when we can get to value creation through our launch and through approval, et cetera, and booking sales, definitely makes people more interested in where Cingulate's going. This recent investment with fundamental investors, I think is really going to bode well for the organization as well. This is a $20 billion market, and just 1% market capture is a lot of revenue, $250 million.
Yeah.
And here's a product that we know is, and we've seen and we believe we've proven to be an exceptional addition to the armamentarium for ADHD. So the opportunities there, I couldn't be more proud of the team that we've assembled in this organization to have guys like this that have such broad experience and just high performers as well, but great people on top of it. And then with Matt and Raul, the team has been very much focused on perseverance. So the team's been working great. Opportunity is fantastic. The market is moving in the right direction. Our ability to capture that also looks really good.
I want to just add, I think that, not lost in all of this is a patient and a mom and a family that's out there saying, what do we do? And how do we handle this? How do we take care of this? And here in short order, we'll have an answer. And the more of those patients we find, through the prescribers and through our omni-channel marketing and approach that we're going to do at launch and articulating the story to payers, the more we identify them and the more the reimbursements get paid for, or we get the reimbursements for the prescriptions, all of this falls into place. Everything falls after we've identified these patients and we fix their problem. And that to me is like, I always never lose out on the opportunity to remind people why we're going out there, why we're getting on planes, and why they're flying late at night and early mornings and getting stuck in airports. Our team, our market access team, like many like our sales leaders, they're out there pounding pavements all the time, and people don't see the time and effort that they're putting in to get to this, successful negotiation. And that to me was kind of the big, sort of final check on, should I come on board? You can clearly see that there's a patient out there who's going to tremendously benefit. So I think 1% is the floor and not necessarily a ceiling for us.
As I've always said, if we captured 10%, we failed.
Yeah.
But that's relatively optimistic too. So in my humble opinion, I believe is what the lawyers like me to say. But again, we built this based upon the needs in the category. I've launched 3 products in this category. Matt and Raul, we've been a part of all these medications. So we brought in the experts. We said what's missing. And entire active day coverage has never been achieved. Never even come close. So we're built this product for the patients and the providers that have seen the data, seen the way it works, understand the effect size and the magnitude and just the durability of the product. They're excited. We're excited. We know that there's a great opportunity here to improve lives and do it in a better way, we hope. And take away those the darn boosters and
Simplify.
simplify, uncomplicate things.
Yeah.
Let's lose the complication in this category.
There was another big picture question I wanted to pose to you. During JP Morgan, there was a lot of conversation about China taking the mantle away from the United States in terms of a biotech leader. And first of all, I'd like your thought on that. And then what can the U.S. government do to maintain our dominance in the space and perhaps build on where we are?
Yeah. Well, first of all, I'll say this: competition is good. And if the Chinese want to adopt that capitalist future, I'm fantastically happy with it. And they have. They are definitely competing with us, and that's a great thing. Just last week, I forget the exact details, was it Merck? They just signed, I think it was Merck, just signed a big deal with a Chinese company to bring the assets they've developed into the United States. So at the end of the day, if we're improving patients' lives, extending our lifespans and doing a better job to treat patients, I'm all for it. And the Chinese there's brilliant people. They're working just as hard as we are here. The government can do one thing and one thing only, and I hope they do, is just get out of our way. Again, I'm not saying FDA here. They're doing the right thing to make sure the product is safe and effective. That's not what I'm talking about. I'm talking about just remove regulations. Improve the way, equity gets raised. Help these companies out by getting out of the way. Let's let the free market decide exactly how the products, the good ones rise to the top, and the other ones maybe fall off. But competition is good, and the Chinese can be a great partner for us in the United States. The group we just executed our capital with is largely coming from some folks with Chinese money, and it's a good thing. They see the value in what Cingulate's doing. They want to partner with us. This group that we're talking about is partnered with Lilly, with Pfizer, with Johnson & Johnson. That's now a part of Cingulate as well. That should get everyone excited about, here's a group of true experts that see the value that Cingulate has. So much so they're putting capital into the company.
Okay. Another theme at the JP Morgan conference and over the last year has been the patent cliff, and I thought we could end on that topic.
That happy topic? Yeah.
Because it has wide-ranging implications throughout the industry, and mostly positive for small companies, I think, because if you need to replace a drug that's going off patent, you need to look at small emerging products that are newly approved. So how do you think that patent cliff is going to affect the environment for small cap biotech?
Yeah, it's the same story, different day, right? And it happens that way. I think for Cingulate, most importantly, for our viewers and investors and shareholders is, as far as someone coming in saying, hey, we're going to buy this company now, most people, especially the big companies, are going to wait and see perspective, unless it's oncology, in which case, we dose 2 patients, one looked good. It's worth $100
Let's give you a couple.
It's worth $100 billion.
Yeah.
So not in that space. What they're going to wait, it's a wait and see perspective. So if we accomplish what we believe the product could accomplish, you're going to see the company do very well. You'll see our market valuation tremendously increase, and we may see some bidders, and we'll definitely listen to those opportunities. The biggest value this company has that still no one has recognized, so maybe we should whisper it: precision timed release. Our platform is revolutionary. There is no drug delivery platform in the market today that has the ability to precisely time release and ratio in a pulse, in a sustained release, in a pulse with 3 different medications or 3 of the same, or put 2 different blends in one. It's so flexible. The really smart folks, like the guys that just put in some capital, they know it, they see it, and they want to partner with us to bring products to the market in China, around Asia, and some of theirs into the United States.
Well, we didn't really get a chance to talk about all the other opportunities for the platform, of which there are many. But Shane, thank you for your time. Bryan, glad to have you here. Rick, welcome to Cingulate, and thank you all for joining me. Again, we had Cingulate, ticker symbol CING.